by all means, go in and have yourself checked out. I didn't think I had any serious issues, but fortunately for me, my doctor picked up on something that I would never have suspected. I'm Mary Smith. I'm 82 years old, and I live in West Pittston.
Mrs. Smith was referred to me by her primary care doctor. She had an echocardiogram or an ultrasound of the heart done, which showed the significant valve disease.
Aortic valve disease parallels many of the other common cardiovascular diseases that we have. The most common symptoms are shortness of breath, chest pain, or dizziness and fainting. But nearly the same percentage of patients, about half the patients, have no symptoms.
We discussed the treatment options and we decided to proceed with TAVR.
TAVR is TAVR, Transcatheter Aortic Valve Replacement, and it's a minimally invasive catheter-based intervention where aortic valves can be replaced without the need for open heart surgery, general anesthesia, incisions.
It's one of the more remarkable things that have come out in the field of interventional cardiology recently. The results are as good as surgery, and the patients have much, much easier recovery time.
Being that I'm 82, I probably had some shortness of breath at times, but I attributed it to age and that if I was doing something strenuous, I might have to stop and just kind of take a breath. Every Wednesday, my husband and I volunteer to do Meals on Wheels. If you don't know anything about Pittston, it's a lot of hills.
We have very high standards. We think that the patients in this community deserve the best medicine that's available here in this community without having to travel.
I have only the best recollection of everything that happened. It just all went really well. Sometimes I have to pinch myself to make sure that it's me because I feel great. I really do.
Don't ignore your symptoms. Always a good idea to have regular follow-up visits with your primary care doctor so that even if you feel like you're healthy, you get regular checkups, you get regular blood work, you get regular testing done. And if there's any change in those testing, you can be referred to an appropriate specialist.